The Women's Fund was created in 1979 to fund research on women's health. From 1980 to 2008, we gave away over $1.3 million for research in Houston. During that time, we published 4 books on women's and girls' health, which were distributed around the community free of charge. In 2008, we switched to a public health model rather than funding research. We currently focus on providing preventative health education by joining with our community partners to go into their neighborhoods to hold seminars and classes. Our current programs serve girls and women by giving them skills for living a healthy life. Our objective is to expand our reach. We want to have a community representative in every underserved area of Houston. We also want to develop more metrics, like tracking our program participants 3 years down the road to see what decisions they've made. In order to get there, we need more of everything. We need more physical resources, more doctors, more volunteers, more community partners, and more staff. Most of these groups give their time for free, but we need funding to reach out to them and bring them together. We leverage a number of resources to deliver an outsized impact given our budgetary constraints. Volunteer teachers facilitate our classes. They allow us to reach many schools simultaneously. We also use volunteer doctors to provide focused seminars. Our community partners host us at their locations, so participants stay right in their own neighborhoods. Doctors voluntarily edit our publications and keep the medical recommendations up to date. Our curriculum classes were developed using evidence-based information, produced by the Centers for Disease Control and the Offices on Women's Health. We get the curriculum and evaluation information for free. We don't reinvent the wheel. The Women's Fund's work is built on the best practices and participation of experts. There are many health education resources available for free to the public, but they're not delivered to the people who need them most. The government produces research and curricula on health education and its outcomes. Community partners work with the needy. Volunteers want to give their time. Someone has to actually bring all of these resources together. The Women's Fund covers the last mile to deliver relevant information that allows the targeted participant to make informed decisions about their health. The Women's Fund tracks quantitative metrics such as number of program participants, the presentation outcomes, volunteer satisfaction, repeat volunteers, and repeat community partners. We have to measure and manage the expectations of each member of our ecosystem because we have to work together to deliver effective outcomes. We routinely validate these metrics with qualitative information. Our work is successful when participants tell us that they've gained knowledge, skills, and attitudes regarding a health topic and made a short-term behavior change. Our work is also successful when our reach is broadened year after year based on community demand. Many people are still learning about our current work. There are many similar-sounding organizations with the word women in the title. In addition, we operated as a foundation for many years, and with the word fund in our name, some misunderstanding is to be expected. Since 2008, we've built a solid foundation in preventative health education work. We've created partnerships all over Houston and the surrounding communities. We're working with schools, community centers, faith-based organizations, and social service agencies. We provide books, seminars, classes, and capacity building for community health projects. We're proud of the manner in which we've united several different stakeholders. Doctors, volunteers, and community partners have come together to improve health outcomes for women, and they wouldn't be doing it without our active participation. Our metrics allow us to estimate the scale of our impact. Our community partners span several of the most underserved neighborhoods in Houston. We have more than 35 volunteers from local colleges, corporations, and communities who serve each year. Since 2009, we've increased our overall reach by 10% annually. Despite our impact, the fact remains that our organization is operating on a small budget. We struggle to retain talent. we struggle to cultivate steady funders. We put tremendous effort into keeping each department of our organization afloat, but we want to grow rather than maintain our size. Our limited staff can't collect as much data as we would like. Our partners don't always inform us of the results after they receive training. So we recognize that our reach may be greater than our current metrics indicate. With stable funding, we can continue our current work and expand our programs by at least 5 to 10% each year. The funding provides the operational and material support needed to produce our current levels of programming. If we receive additional funding, we'll hire more educators. An increased number of educators on staff will significantly multiply our programming and our volunteers. Having more resources will allow us to get health information into more neighborhoods all over the city. Our goal is to reach as many Houston area women and girls as possible. Every school, community center, faith-based organization, and social service agency could have an educational program provided by us. We could serve whole school districts. We could continue to provide our programs outside of the scholastic environment as well. We could reach the 8 counties that surround Houston. We know our training model and program are already effective in changing lives, and we want to do more. We created a fun and interactive way to learn about health, and we want to share it with others. Ultimately, our resources could benefit communities beyond Houston and the state of Texas.